Ajanta sir, Dr. Ajanta Shivaji Kotekar, Head and Professor of Department of Roganitana, HOD of the department, Dr. Beena MP, UG Coordinator and Professor, Dr. Deepa Patil, and my colleagues and my dear students. On behalf of the institution and Department of Kaya Chikitsa, I welcome you all for the webinar series, which is organized by Department of Kaya Chikitsa in JSSAMC Mysore. We all are going through a tough situation due to current second wave of COVID-19. And once again, we all are forced to stay back in our houses. Of course, this time also will pass, but education, especially medical education, should be a continuous process. And luckily, we have various online platforms to keep up updated in the field. So that's a reason Department of Kaya Chikitsa decided to conduct webinar series on such topics which will improve the knowledge and the practical approach also, which is a major missing in this pandemic situation. So it will be 100% beneficial to the students, and I request all the students to participate in the sessions positively. Now, I request HOD of the department, Dr. Beena MD, to deliver the welcome speech.
Thank you, Dr. Krishnan. Good evening to one and all. Respected Principal Sir, Dean Sir, and all the faculty members. It's my privilege to welcome you all for the guest lecture series organized by the Department of Kaya Chikitsa, JSS Ayurveda Medical College, Mysuru. Today we have with us the renowned resource person, Dr. Ajanta Shivaji Kotekar Sir, Professor and Head, Department of Roganidana, Sharda Ayurveda Medical College, Mangaluru, having vast clinical experience, who is also my senior in Government Ayurveda Medical College, Mysuru, when we were doing our PG. And he is going to speak on the topic, the burning problem, that is KATI, SHOOLA and Gradrasi, and its diagnosis and management. On behalf of the institution and Department of Kaya Chikitsa, I heartily welcome you, sir.
Welcome.
I welcome our principal, sir, Dr. Sarbeshwarkar, sir, to this program. Welcome you, sir. I also welcome our Dean, Rajesh A. Udapudi, to this program. Welcome you, sir. I would like to welcome all the faculty members, especially the Department of Kaya Chikitsa, to this program. And our future is our students. So I welcome each one of you to this knowledge sharing program. Once again, I welcome you all. Thank you. Thank you, one and all.
Thank you, madam. And I welcome you to the session. Now I request Dr. Deepa Patil, Professor and UG Coordinator, the institution, to introduce the chief guest to the session.
Om Shri Dhanvantaraya Namaha. Good afternoon, everyone. It gives me an immense pleasure to introduce my batchmate and my sharing knowledge person, Dr. Ajanta, where we were doing our MD, PG in Government Ayurveda College. We were the batchmates, where we shared, had a good knowledge experience sharing during the studies. And he was favorite, not only favorite to all the teachers, but to the students. It gives me I'm going to introduce Dr. Ajanta. Dr. Ajanta completed his BAMS education in SDM Udupi, his MD in Government Ayurveda College in the Department of Kaya Chikitsa, and he has done a PhD in Kaya Chikitsa from IPGT or Jamnagar, Gujarat. During his MD and PhD, his research work was in male infertility, and where he has given surprise specialization skills in male infertility management through Ayurveda. He has done postgraduate diploma in yoga and naturopathy from Gujarat Ayurveda University, and he has conducted research work on osteoarthritis. He has 20 years of clinical experience treating patients with different diseases connected to Kaya Chikitsa specialization along with male infertility. In He has a teaching experience for BAMS of 13 years, MD of 13 years, and he is a teacher of international Ayurveda and yoga teaching experience at London and United Kingdom. He has guided more than 90 PG scholars, and additionally, he is a Dean for Student Welfare Affairs, the head of the Department Internal Quality Assurance Committee member. He has 54 scientific article publications in both national and international peer-reviewed journals. He has worked as a PI and co-PI in 3 funded research projects at RGHS University, Bangalore. And he has a resource person for periodic in international teaching program attended by the students from different countries. He is an organizing coordinator of Center for International Studies and Research in Ayurveda. And he has an author and guided more than 46 presentations. And it's very immense pleasure to announce that he is bestowed with the STM Guru Award for Best Teacher Award in the year 2020. I congratulate you, Dr. Ajanta, for this one. And I welcome you to the guest lecture series. And I request you to take over the session.
Is the slide visible? Is the slide visible?
Yes, sir. Yes,
Visible?
Ajanta. Yeah, Ajanta, it is visible.
Can you hear me? So is it on? Hello?
Yeah. The screen is visible, Ajanta.
Okay. Good afternoon, or rather it is good evening, everyone. I thank all of you. Before I begin, my prostrations to the lotus feet of Jagadguru Sri Shivaratri Deshakendra Mahaswamiji. On this occasion, am I audible? Is the voice audible?
Sir, it is audible, sir.
Okay, thank you.
But
So-
since the mic is moving, I think there is a lot of disturbance.
Is it okay?
It is clear now, sir. Now it is clear.
Yeah, thank you. So the Department of Kaya Chikitsa, I congratulate you on this occasion. Before starting, I would like to thank the principal as well as the dean for providing this opportunity. And I'm very grateful to the Department of Kaya Chikitsa, JSS College of Ayurveda, Mysuru. Now, today's topic is clinical diagnostic approach to KATI, SHOOLA and Gridresi. Dear friends, you all know this is a call, and I'm also told that the people who will be attending this particular session would be from the undergraduation, very particularly from the final year. Therefore, I have kept the presentation very simple. Still, if you have any doubts at any point of time, you can ask me the doubts. So I hope we will begin. Now we have two important entities that we'll be discussing today, because the KATI, SHOOLA, or the pain in the low back, encompasses many disorders. It is not only limited to the spine, rather it encompasses different disorders, particularly the parabdominal conditions, could be the urinary tract infections, the reproductive problems, particularly in females. There are many systems that are connected in and around the low back. Therefore, any disease that can mimic as low back. Therefore, it is very important for one to specifically diagnose the condition. Since this is a large topic, I will be limiting myself towards the clinical diagnostic approach to KATI, SHOOLA and Gridresi, very specifically to the lumbosacral vertebrae. Now, dear friends, whenever we talk about KATI, SHOOLA, one of the common thing that comes to our mind is there is some pain, very particularly in and around the KATI Pradesha, particularly the lumbar region. And this may be accompanied sometimes with stiffness, and sometimes it may be very crippling. And the person who is suffering from such a disease cannot go to the work also. Now, this particular disease, KATI, SHOOLA, which is enumerated in Ayurveda, is also referred as lumbago, wherein it refers to pain in the lumbar area, could be in the lumbosacral areas, or very specifically also in the sacroiliac joints. The other condition that we'll be discussing today is gridresi. As you all know, it is a condition where SHOOLA is the component which begins from the spicpurva katiprashta, radiating up till the father. And this is also rightly identified as sciatica, the pain that radiates along the sciatic nerve. Typically, it is felt in the buttock region, then it radiates down the lower limb on the posterior aspect, very specifically till the foot. Therefore, these are the two basic components that we'll be discussing, keeping all other disorders pertaining to KATI SHOOLA in Ayurveda text for differential diagnosis. I said this is in the first slide, it is clinical diagnostic approach to KATI SHOOLA and gridresi. Imagine there is a patient coming to you in the clinic, and when that happens, the clinical diagnostic approach, there is a particular diagnostic approach should be clinical. If you have to think in that line, then there are various steps that require to be followed by the physician, which makes the disease. So, dear friends, these two conditions I will be presenting before you in different steps as etiological diagnosis, anatomical diagnosis, pathological diagnosis, clinical diagnosis, laboratory diagnosis, then the tentative diagnosis, differential diagnosis, arriving at a concrete diagnosis. So these are the various steps that a scholar required to keep in mind when they approach the patient. And this particular tentative diagnosis should be applied right from the beginning. That is, when from the etiological diagnosis, at every step, whenever he gets an information from the patient, he should apply this point of tentative diagnosis. This should go in his mind. This could be the condition. This could be the condition. And as you pass through the different stages of this, diagnosis, etiological, anatomical, pathological, clinical, laboratory, and differential diagnosis, you arrive at a very concrete diagnosis. So, dear friends, the first point that you should keep in mind is etiological diagnosis. Now, the question arises how to arrive at the etiological diagnosis. Most of the time, the patient fails to identify the nidana. Therefore, a very in-depth case taking is the tool. One should take the case to the depth. Therefore, I always say history recording is an art. Therefore, one should always have this art of history recording to arrive at this understanding of specific nidana. This is very important with respect to Ayurveda because we'll be dealing with Sannikrishta Hetu, Viprakrishta Hetu, Vyabhichari Hetu, Pradhanika Hetu, etc., which I'll be dealing later to give you a comprehensive understanding. Now, dear friends, in the contemporary practice in the clinic, when a patient comes with such conditions of KATI SHOOLA as well as gridresi, most of the common things that could be involved when you take the history to arrive at the etiological diagnosis, I would like to point out some. One is the change in lifestyle, and other this could be somatic, and sometimes most involved in traveling, excess of traveling, attaining wrong postures, traveling to long distances. Another biggest problem is the obesity. You know, the upper part of the trunk is connected to the lower part of the trunk by only the lumbar vertebrae. So more the obesity, more the fat, the strength of the vertebra as well as the muscles in and around becomes very weak. The smoking and junk food, this contributes a lot towards the proliferation and the nutrition of the different systems in the body, particularly the spine, the muscles, etc., which also on a long run would contribute towards these problems. Dear friends, now you are listening to this particular guest lecture. Now, if you look at your position, how you are sitting, are you sleeping, etc. If you look into the ergonomics in the sense whether you are sitting properly, whether you are sleeping properly, the posture that you adopt is very important. Most of you may be sitting in an improper posture. Some may be sleeping in an improper posture now. This also contributes to this particular pathology in the common clinical practice. The other important point is the occupation. The occupation, as you all know, in activities, there could be some non-serious muscle as well as skeletal issues. which leads to sprains and strains. This also could be contributory to low backache, particularly the KATI, and Gridresi. Now, apart from this, there are many other conditions which also in the low back. It could be the musculoskeletal mechanical causes like osteoarthritis, degeneration of the disc. There could be disc pathology, the vertebral fractures, sometimes the spinal canal stenosis. There could be a tumor in the spinal canal stenosis. This also can lead to the that appears like Gridresi or KATI. You also require to keep in mind while taking the history whether the patients are suffering from these conditions, so that it will help you to make a differential diagnosis. Now imagine you are taking the history with the patient, you have dealt with these many points, you have been eliciting the history indirectly with open questions. Now you also require to keep in mind and elicit the other conditions that the patient may be suffering to make a differential diagnosis. He may be suffering from inflammatory pathology, etiologies like HLA-B27 associated arthritis. He may be suffering from ankylosing spondylitis. He may be suffering from sometimes inflammatory bowel disease that also can give rise to pain in the low back. So this has to be kept in mind always. The other conditions could be infections like osteomyelitis, the local abscess in the low back. The patient may be suffering from malignancy, the tumors. It could be the metastasis in the low back vertebrae from the lung, could be from the breast, could be from the prostate, could be from the thyroid. These are very common in the clinical practices today. So when you elicit the history, this is very important to arrive at the etiological diagnosis. And if you are evaluating a female, it is very important to keep in mind that there could be many issues related to the female reproductive system. The female may be suffering from endometriosis, ovarian cyst, ovarian cancer, sometimes uterine fibroid, and also in pregnancy also there could be pain in low back. So you require these options open to make some psychological reasons also. And nowadays fibromyalgia is one of the common disorder that you see in the public. Now, always keep in mind one of the common cause that lead to low back ache is lifting. You can see you never should bend forward and lift the objects. That will cause a devastating effect over the spine. It should be always you require to sit properly, hold the object and stand. The second is when you work, your posture is very important. And when you stand, when you walk, the posture is very important. This also can put a lot of strain over the back. Therefore, when you take the history, you should keep this in mind and you should elicit these points with the patients. I said there could be many other disorders that causes back pain. There could be, if the patient is suffering from kidney disorders, if the patient is suffering from pancreatic disorders, there could be many other disorders which I have already enumerated. They are non-mechanical diseases that also can give rise to low back ache. Therefore, you require to make a differential diagnosis right when you're taking the history, when you're arriving at the etiological diagnosis. Many a times, the patient may suffer from trauma. There could be a road traffic accident. They might have fallen somewhere. Then sometimes, or in most of the old people, it is the degenerative conditions. But now what we find is even the young people, they also suffer from the low back ache due to some different degenerative conditions. Therefore, this set of nidanas, it goes on increasing. There is a long list of nidanas which you can enumerate, history taking, and you should try to elicit. Now, why this is very important? When it comes to Ayurveda, the understanding, it is very important because you know the Nidana Panchaka are the Vyadhi Bodhaka Nidanas, but Vyadhi Utpadaka Nidana, that is the etiological factors, which we call it as etiological diagnosis, you require to differentiate it into either Sannikrishta, those are the near causes, Viprakrishta, the far causes, then you know the Vyabhichari and Pradhanya, which I'll be explaining in the next slides. Now, what does this do? This is very important. This can bring about dosha vriddhi or prakopa. This brings about, please keep this in mind, this is very important. These nidana will bring about dosha vriddhi. Later it will bring about dosha prakopa in nija vyadhis. And this nidana, when it brings about dosha prakopa, at the same time it also brings about dhatu shaitilyata. You understand, the different dhatus which are present in that low back area, it becomes weak. And very particularly, it could be at the disc or it could be at the vertebra in spondylolisthesis, the Kavaigunya Utpatti can take place. Therefore, please keep in mind, the etiological diagnosis is very important. Why? Because that etiology is responsible for bringing about dosha vriddhi and prakopa as a nija vyadhi. That is responsible. That same nidana is responsible for bringing about dhatu shaitilyata. The same nidana contributes further to kavaigunya utpatti, or the weak spot in the low back is generated. It is not that all who fall will suffer from a low back ache or low back disorders. Only some will suffer because due to the involvement in the nidana, kavaigunya utpatti has taken place. How it has taken place? Because of the dhatu shaitilyata. And why dhatu shaitilyata? It is because of the involvement in the nidanas. Now, try to understand, there are two types of nidanas. One is Sannikrishta nidana and other is nidana. The abhigata, or that is for injury to the Sannikrishta nidanas. The food that and the vihara that you adopt, they form the Viprakrishta nidanas. Due to Viprakrishta nidana, dhatu shaitilyata has occurred and kavaigunya utpatti has taken place, and a small Sannikrishta karana like abhigata and apatamsana can lead to KATI SHOOLA as well as the gridresi. Now, please keep in mind, if the intensity is more, then it can lead to Sandhi Chuti or Sandhi Bhagna in the low back. And if the intensity is less, it can lead to minor injury to the Sira, Snayu, Kandara, Asti, which is present in the Kati Pradesha and result in KATI SHOOLA. One thing always you should keep in mind, especially when you're treating the disorders, that is Marmabhigata. Because Marmabhigata also results in these two conditions. Therefore, in this, when the person involves in the nidana, the SHOOLA is due to vata prakopa. It may be sometimes acute or sometimes it may be very severe pain in the kati, causing KATI SHOOLA, and sometimes if radiation do manifest, then the kandaras will be involved, and this particular entity is identified as gridresi. Therefore, initially it could be only KATI SHOOLA, later transforming into gridresi. Sometimes if the Sannikrishta nidana can directly cause gridresi. So I said these aharajanya nidanas. Now you may have a question: what is how ahara, etc. These are related with the low back ache. It is the low back ache or the low back area, the various kandaras, snayu, sandhi, they become weak, or dhatu shaitilyata and kavaigunya utpatti takes place because of the ahara and vihara that we have indulged in. Now the question arises how this can happen. Then I think I'll explain it when I'll be going to the pathological diagnosis. So what is the Viprakrishta hetu in the patient? Make a list out of it and ask all the possible etiologies that can cause low back ache, so that will help you at the end to make the differential diagnosis or Vivachcheda Nidana. The anatomical diagnosis, when you are arriving at the etiological diagnosis, it becomes more clear which anatomical structure is involved, whether it is the asti that is involved, whether sandhi is involved, sira, snayu, kandara is involved. These are the common structure that is involved in low back ache and gridresi, in KATI SHOOLA as well as gridresi. Very particularly, it is the bones, cartilages, muscles, ligaments, and the nerves very principally gets involved in this pathology. This will help you to formulate the treatment later, as well as to understand the prognosis. So when you ask the history in this part, in this disorder of KATI SHOOLA as well as gridresi, try to make a precise anatomical diagnosis. I'll elaborate on the further aspects after anatomical diagnosis when I will be speaking on ecological diagnosis. Once you have done the etiological diagnosis as well as anatomical diagnosis, you are required to precisely understand what is the pathology that is going on there. So whether it is KATI SHOOLA or gridresi, if it is KATI SHOOLA, whether it is presents as a lakshana here, or whether it is a vyadi, or whether it is an upadrava, and if the person is suffering from gridresi, then it is a vata vyadi, it is an anatmaja vata vyadi. Whether it is vataja type of gridresi or vata kaphaja type of gridresi, this understanding is very important. There is one more thing that you require to make note of while eliciting the pathological diagnosis with the patient, that is the duration. Whether it is acute, if it is acute, then the symptoms are less than 6 weeks. If it is subacute, it is between 6 to 12 weeks. And if it is chronic, it is more than 12 weeks. Let us trace the pathological basis of KATI SHOOLA, because this will help you, this knowledge will help you in making a differential diagnosis at the end of this presentation. If you look into the Vedas, you do not find this KATI SHOOLA being explained as the separate entity, so also in Brihatrai. But in Brihatrai, it is explained as a Lakshana in different disorders like Ajirna, Kshatakshina, Vatajajvara, and very interestingly, Vrakka Vidradi. I said urinary tract disorders are also very important when it comes to differential diagnosis. Now, Sharangandra Samhita has enumerated KATI SHOOLA as a Vataja and Atmaja Vikara, and in Gada Nigraha as well as Bhava Prakasha, also you find this mentioned as a separate entity. Yoga Ratnakara has explained this as a Lakshana, KATI SHOOLA as a Lakshana in the context of Vataja Arshas, Udasthita Vata, as well as in Pakvashayagata Vata. Therefore, if you look into Brihat Nigantu Ratnakar as well as Dhanvantari Nigantu, it is explained in the context of Bhagandhara. And in Nidana Chikitsa Hastamalaka, you find the Upashaya and Anupashaya that has been explained there. We have research on this, and the article is available in Google. You can Google that and you can read that article also. So now mentioning of all these diseases here is very important. I thought it is very important because all these diseases will be taken at the end for the purpose of differential diagnosis. Because in these diseases, either KATI SHOOLA or Trika Vedana, different symptomatology has been enumerated, which will help you to make a precise diagnosis. Now, if I have to take the continuation from the etiological diagnosis, I said the Sannikrishta Nidana and Viprakrishta Nidana understanding is very important. You may have the question, it is why? It is very simple. If you look into each of the doshas are being attributed with the different gunas. You can see on the screen the different gunas attributed to the different doshas. This you have studied in the first year. Now, when the person involves in ahara or in the vihara, it is these gunas that gets increased in the body. First, it is the vriddhi of this guna that can take place, and next, if it continues, the prakopa of these gunas takes place. And as these gunas vriddhi takes place at the doshic level, it is those doshas which gets vitiated. Particularly here, it could be only vata dosha, or sometimes kapha may be involved along with it. Now, always you should keep in mind, it is not with the etiology or with the nidana, it is not the dosha first getting vitiated and then dhatu getting vitiated. It's not that. It is always that when a person involves in the nidana, the dosha gets vitiated. At the same time, that nidana will bring about the dushti of dhatu. Either vruddhi of dhatu will take place or kshaya of dhatu will take place. You may have the question, how? It is because of those gunas. When the person involves in the ahara and vihara, the above gunas will bring it to increase or decrease of the dhatus. Not considered because it cannot cause the disease, but when it comes to dhatu, vriddhi and kshaya of the dhatu is very important. Always you require to keep in mind that there is ashraya bhava sambandha. Therefore, now it is very clear that vata dosha or kapha dosha that is involved in this pathology, the dhatu, particularly rakta, mamsa, meda, asti, up to some extent majja is involved, and there is a interrelationship between this dosha and dhatu in the manifestation of the pathology. So this is very important. Please keep this in mind. Hence, you have deduced the etiological diagnosis. From the etiological diagnosis, looking into the gunas, now it is very clear that which dosha is involved here, which dhatu might be involved here. It is very clear to you, and you also know the relationship between the ashraya bhava sambandha between the dosha and the dhatus. Now, when you talk about the food is judged based upon the rasas, and each rasa also has got the dominancy of the guna, and this dominancy of the guna contributes to the dushti of the doshas. Hence, whatever the food that he has taken, it may act as a viprakrishta karana in bringing about the dhatu shaitilyata and kavaigunya in the low back. So this is always important. Further, when there is a change in the season or the rutu, this also will bring about the change or decrease or increase in the gunas of the doshas, which will lead to the increase in the doshas, further contributing to the pathology. Now, very specifically, if I have to explain how the Nidana causes the Dhatu Shaitilyata, when the person involves in the Nidana, principally it will afflict the Koshtagni, then it will afflict the Dhatuagni, the Sthayi and the Sthayi Dhatu, the Poshaka or the Poshya Bhavas will get affected. When this happens, the Margastha and Sthanastha Dhatu will get affected. This ultimately leads to Dhatu Kshaya. And when there is Kshaya of the Dhatus, you have studied under Dashavida Pariksha, the Dhatu Sara, and the Dhatu Sara of those particular Dhatus will decrease. Those Dhatus fail to resist from the disease, and this leads to Dhatu Shaitilyata. And this Dhatu Shaitilyata can take place throughout the Dhatu, throughout the Asti Dhatu, all over the body. But in this disease, the Kavai Gunya is the low back, which will be the place where it will undergo insult. Therefore, the Dhatu Shaitilya in the low back will bring about Kavai Gunya, and there the pathology will manifest. So, Avatamsana Abhigata acts as a Sannikrishta Karana. With the Viprakrishta Karana, already Dhatu Shaitilyata is present. I told you Kavai Gunya is present. Now, if the person falls due to Apatamsana or Abhigata, it acts as a Sannikrishta Karana, leading to different types of fractures or different types of pathologies manifesting as KATI, SHOOLA or Gridrasi. It is quite interesting. I would just mention there are two marmas that you require to keep in mind. One is the Kukundara marma, because it is said in this context that Chesta Hani of other Kaya and Sparsha Asajnata is being told. As well as next is the Nitamba marma. In Nitamba marma also other Kaya Shosha and Daurbalya is explained. Therefore, always you require to investigate whether these two marmas are involved in a person who comes to you for the treatment of KATI, SHOOLA as well as Gridrasi. This is very important to be evaluated. So when it comes to Viharajanya also, it is the same rule applies. It is the gunas that increase in the body that is responsible for bringing about the change in the doshas. And the Vihara sometimes can also act as Sannikrishta Karana. Gaja, Ushtra, Ashwa, Shigrayana, Yana has been explained in the textbook. But today we have people traveling with the motor vehicles where there is jerky movements. So you can go on enumerating such lots of Nidanas, the bad posture, repeated bending. All this causes stress and strain to the low back, very particularly the bones, the cartilages, the intervertebral disc, the ligaments, as well as the muscles which are present in the low back, leading to the pathology. There is one more important thing, that is the congenital diseases like spot-many disorders. This should be understood as Janmabala Pravritta Vyadis, and the Kavai Gunya is present in the low backache, and there is a Dhatu Shaitilyata, and this is responsible for bringing about the Sthana Samshraya of the doshas in that part, leading to KATI, SHOOLA and Gridrasi. Therefore, all these Nidanas, in precise, if I have to say, all these Nidanas lead to Vata Prakopa directly, or Vata Prakopa because of Dhatu Kshaya. Sometimes even Avarna is responsible for bringing about Dhatu Kshaya. Therefore, one has to analyze the doshas, dusha, which are involved by questionnaire, by asking the questions to the patient, while deducing the ecological diagnosis, so that you can arrive at a very particular pathological diagnosis. So now if I have to summarize, please listen to this very carefully. You can get the point here. The vitiated vata takes ashraya in the KATI Pradesha. This leads to the shoshana of the Shleshaka Kapha that is present in the Sandhi. This leads to the hampered functioning of the joints, preventing all the movement in the KATI Pradesha. Thus, the movement at the lumbosacral region, like flexion, extension, lateral flexion, etc., rotation, are hampered either completely or partially. Now, the degree of affliction varies depending upon the presentation of etiological factors, such as the site of the structures injured, and the extent of the injury, and the duration, since how long the person is suffering from that insult. If the vitiation is due to abhigata, pain can manifest because of injury to the sandhi as well as the surrounding structures. The one more important point with respect to Gridrasi is radiation of pain in the nerve course towards the lower limb is due to the defect in the intervertebral disc, which generates the tension over the nerve roots, passing out, manifesting as Gridrasi. In very short, the people may be, with respect to lumbosacral spine, the patient may be suffering from spine osteoarthritis, bulging or the ruptured disc, spinal stenosis, osteoporosis, then vertebral stress fractures. Sometimes it could be even muscle sprain and strains also. All this leads to KATI, SHOOLA or redressy. One thing always you should keep in mind is, if the patient is suffering from intervertebral disc disorder, which is leading to redressy, you should know it is not the disc that is getting sprained. There is a disc and that disc gets skipped. It's not that happening. It is not that happening. You try to understand here. You can see the 4 stages there. You can see the disc. The disc has got 2 parts. The center is the nucleus pulposus. The side is the annulus fibrosus. When it undergoes degeneration in the first stage, you can see the disc is stretched and it does not completely return to its normal when the pressure is removed. It retains a slight bulge at one side. And some of the inner disc fibers could be torn in this condition. This particular condition, they had to identify it as a disc bulge. So when you go through the reports, they say there is a disc bulge. This is what is happening. Now the annulus fibrosis, it can protrude out. So such a stage is called as prolapse, or it is called as protrusion. The first stage is called as a bulge. The second stage is called as protrusion. In the protrusion, here the bulge is very prominent, and the nucleus pulposus is the central portion. It gets spilled out to the inner edge of the outer fibers, barely held in by the remaining disc fibers. In the sense, the inner nucleus pulposus, it moves out towards the annulus fibrosus, but it does not come out of the annulus fibrosus. Such a stage is called as a disc prolapse. So this is what happens when you read a MRI report where disc prolapse is written. Now, in some conditions, in some advanced conditions, you can have this outer annulus fibrosus torn open and the nucleus pulposus coming out of it. This condition is called as extrusion. In the later stage, what happens is the nucleus pulposus from the center, it moves out of the annulus fibrosus, it moves out and it gets separated, and it gets separated from it. Such a condition is called as sequestration. In the sequestration stage, it is very, very difficult for the treatment. So always when there is, somebody says there is a disc lesion, try to figure out whether it is degeneration, prolapse, extrusion, or sequestration, because this is which will contribute to the further pathologies. So please, you can understand this pathology. Here you can see the normal intervertebral disc. The second disc will show you the degeneration, maybe due to the, I said, due to the viprakrishta karanas, the person who is involving in. And later, it can lead to bulge in the disease. And further in the stage on the you can see that small herniation coming out. It is the nucleus pulposus which is coming out. You can see the disc bulge. Next, it has opened and the nucleus pulposus is just coming out, which we sequestration stage. This nucleus pulposus comes out of the herniated, comes out of the annulus fibrosus, and it gets separated from it, whereby the disc gets very thin. That you can see the thinning of the disc. And now when this proceeds, am I audible? Am I audible?
Yes,
Hello?
sir. Yes, sir.
What can happen is it can lead to the disc degeneration, whereby the osteophytes, etc., will start forming. I think the screen has stopped working. There is a problem. Can you give me the please wait for a second. There's some problem with the screen.
Okay, sir. Okay. I think network issue irbodu.
Is it visible? Just a minute.
Yeah.
It's getting connected. Can you let me in, please?
Yes, sir.
Can you share my screen, please?
You can, sir.
It says host has disabled participant screen sharing.
Sir, 1 second, sir.
Yeah.
Sir, you can try now, sir.
Can you see it?
Yes, sir. Audible, sir. It is visible, sir.
Is it visible?
Visible, sir. Visible.
Okay. So, yeah. How many minutes I have? How many more minutes?
Sir, no problem, sir. You can continue, sir. 10 more
How many
minutes.
more minutes I have?
10 more minutes is no problem, sir.
Okay.
Sir, am I audible, sir?
Okay. So there could be some conditions like the spondylolisthesis wherein am I audible?
You are audible, sir.
Hello?
Yes, sir. You are audible.
Hello? Am
You
I
are
audible?
audible, sir. You are audible, sir.
Am I audible? Hello?
Yes, sir. Yes, sir.
Hello?
Yeah, audible, sir. I think.
So there could be some conditions like spondylolisthesis. Yeah. Yes, thank you. So there could be some conditions like spondylolisthesis. In such conditions also you will find. Yeah, in such a condition, in spondylolisthesis, you'll have the whole vertebra getting skipped. So this condition you require to be very careful because here the stabilization of the vertebral column is very important. Diagnosis is very, very important. So the next point would be the clinical diagnosis. In clinical diagnosis, I know you being the students, many of the students who are here, you're thorough with musculoskeletal system. General examination is very important. Status of the patient, whether it is adequate. This also contributes to low backache. Another important point that you require to understand is the systemic examination. I said there are many other conditions also that can lead to low backache. Therefore, a thorough investigation into the examination of the abdomen, the examination of genitourinary system, very particularly in females, pervaginal examination. In both the sexes, it is the rectal examination. This has to be carried out to rule out other pathology that could manifest. And very specifically, musculoskeletal system examination finds merit in this particular disorder. Hello? I have some problem with the screen sharing.
Yeah, but your voice is audible, sir.
Now, there are the slides. I don't think they can understand it.
Janta sir,
Hello.
if you can send the PPT, I can share from this side.
Yeah, it will take a little time, I think, to close everything.
You can WhatsApp me or mail me. I can share it from this.
Can I take a 5 minutes break?
Okay, sir. Okay, sir.
2-3 minutes break. I'll mail it to you. Hello.
Yes, sir. Yes, sir.
Hello.
Yes, sir. You are audible, sir.
I think now it is. Is it visible now?
No, sir.
Hello.
No, sir. It is not visible, sir.
Okay. So, shall I take 5 minutes?
No
I'll
problem,
mail
sir.
it to you. I'll
No
mail,
problem.
mail it to you.
Okay, sir.
Please be online.
Sure, sure. Students, be in the session. Don't leave the session as there is a network issue. It will be sorted out soon.
Hello, am I audible?
Yes, sir. You're audible, sir.
Did you get the mail, please?
Downloading it, sir.
Yeah.
Shall I share it, sir?
Yeah, please do that.
I think we were in this slide, sir. You were in this slide.
Spondylolisthesis.
This one, sir. This one, right, sir?
Yeah, right.
Yes, sir.
Can you present? Yeah, thank you.
Yes, sir.
I'll put my video off so that it will be easy. Otherwise, there is some problem with the issues with the network. Am I audible now clearly?
Yes, sir. Yes, yes.
Yeah, thank you. Sorry for the interruption. There was some problem with the network here. So I was talking about the spondylolisthesis. This is very important when it comes to the diagnosis. I was talking about the general examination. Can you put on the next slide, please? General examination. I was talking about general examination, systemic examination. Then I said regarding the musculoskeletal system examination. This is very important that the student or the physician gives much importance. General examination, I told to understand the nutrition, etc. Systemic examination to rule out other many diseases that can bring about low backache and which can mimic the disease sciatica or lumbago. Musculoskeletal system examination is very important. It can give us many leads towards the diagnosis. Under the clinical diagnosis, when you go through Ayurveda, so when you'll be examining the patient who is suffering from these disorders, you require to evaluate these following clinical signs and symptoms. The cardinal symptoms of Gridrasi that has been explained in the textbook. He says Toda, it is the pricking type of pain that can be present. Stamba, that is the stiffness can be present in the patient. Muhu Spandana, that there could be numbness present in the patient. Chakrapani says that the fashion of the pain that is presented in case of Gridrasi is the pain will be present in the Spik Pradesha, which that is in the buttock region, which later radiates to the back, then the posterior aspect of the thighs, then down the leg region till the foot. This is very characteristic of sciatica. Therefore, one has to evaluate this particular clinical presentation in the patient. Now, in some patient, they may have the following the symptoms. Then the diagnosis would be that the patient is suffering from Vata Kaphaja Gridrasi. The previous symptoms that I explained, Toda, Stamba, Muhu Spandana, and the pain radiating indicates the Vataja pathology. And in Vata Kaphaja pathology, the patient may have Tandra, Gaurava, Aruchi, Bhaktadvesha, and Mukha Praseka. If these lakshanas are present, then kapha involvement has to be thought of. I think the previous slide, the previous slide. Here Bhava Prakasha, Madhavanidhan and Yoga Ratnakara also have added previous, not next one, previous. They have explained about the Dehasya Pravakrata, Janu Uru Sandhis Purana. Previous one, please. Previous. And very important is the Sushruta. Yeah, thank you. Sushruta and Vagbhata, they have very specifically said that Sakti Kshepa Nigraha. Now the various, this is a very characteristic symptom or the sign lead that has been presented in the textbook, which gives us the idea that the patient will have problem with lifting his leg. These are elicited by the different tests that is said in the clinical books, which I'll be mentioning it very quickly. Next one, please. Next slide, please. Next slide, please. So when it comes to observation in the patient in the inspection, you should see the spinal curvature, whether scoliosis, kyphosis is present, whether there is any enlargement, etc. Different things requires to be seen. Next one, please. I told you that in Sushruta and Vagbhata, they have, next slide, please. Sushruta and Vagbhata very specifically has said Sakti Kshepa Nigraha. That is, the patient finds difficulty in raising the leg. And this can be evaluated by SLR test. Now, SLR test can be done actively or by passively. Passively, the physician lifts the leg of the patient. This SLR test is called as straight leg raising test. And active is the patient raises on their own. Now, this is done in two ways. One is ipsilateral, other is contralateral. The patient has got pain in the right lower limb. If the physician lifts the same lower limb, then it becomes ipsilateral. Now, if the other leg is normal, and if the physician lifts the normal leg of the patient, that is called as contralateral. This is very important. If on lifting the normal leg, if there is pain in low back, then it indicates that definitely the disease is very devastating. Possibly there is protrusion or extrusion or sequestration. Similarly, when you go for straight leg raising test, what happens is when you raise the leg, initially, if the SLR becomes positive between 0 to 30 degree, it indicates that there is nerve root compression, and possibly there is disc herniation. And if SLR becomes positive in between 30 to 70 degrees, most probably it is the prolapse disc. And if the SLR is positive above 70 degrees, then possibly it must be due to sacroiliac joint involvement. And if the patient can lift the leg till 90 degrees, it gives you a understanding that possibly he is not suffering from the lumbar spine disorder, rather he is suffering from some other diseases which is connected to the lumbar and the sacral area. Therefore, this is very important. I said active SLR, passive SLR, ipsilateral and contralateral. So also you can further confirm with the Breguet's test. At the maximum point of SLR, you have to dorsiflex the foot. This will further confirm the diagnosis. Now, there is something called as Lasigu's sign. This Lasigu's sign can be done in sitting position. When it is done in sitting position, we call it as flip sign. Wherein when the leg is when the leg is straightened, it causes tension over the low back and the patient lurches backwards. The involvement of the femoral root can be checked by the femoral nerve stretch test, where the patient is made to lie in the prone position and the leg is flexed at the knee and it is raised backwards. So this generates pain in the thigh area, which confirms the involvement of femoral nerve root. And the next test would be the bowstring test. So in the bowstring test, you give pressure, you lift the leg of the patient. Then when the patient feels pain, as in SLR, slightly relax and then give a punch in the popliteal fossa over the sciatic nerve. So this test is called as bowstring test. This also is used for further confirmation. In Lasigu's test, first we flex the leg at the hip, also at the knee, and then the leg is straightened. This causes pressure over the sciatic nerve, and this generates pain. This test also is confirmatory of sciatica. The Scober's test is very important. It will give you an idea whether the flexion at the low back is possible. Usually, you can see the three lines in between the first and the second line. You have 5 centimeter. That line is drawn at the dimple of Venus. Above that, another line is drawn at the distance of 10 centimeters. So when the patient bends forward, it should increase by 5 to 7 centimeters. Then it indicates that the flexion at the low back is normal, or else the movement restriction at the low back can also be gauged. So the next most important thing is the involvement of the different dermatomes. You can see the different dermatomes, areas that is involved. So when you go for examination, if there is a lesion of L4 nerve that is at the level of L3 and L4 vertebra, then it causes pain and numbness. There could be pain and numbness in the medial as well as lower leg and the foot. There is reduced knee jerk, and sometimes the patient will walk on the heels. And if the involvement is at the level of L4 and L5 vertebra, particularly the L5 nerve root, this causes weakness in the extension of the big toe, and sometimes the patient also complains of foot to drop. The patient can have pain and numbness very particularly in the web of the feet between the great toe as well as the second toe. If the patient has got the lesion at the level of L5 and S1, that is, if the patient S1 nerve root is involved, then there will be pain on the lateral side and outside of the foot. The patient, when you elicit, will have reduced ankle jerk, and the patient usually will have tiptoe walking. He will be walking on the tip of the toes, which is characteristic of the gait of the vulture, that is Gridrasi. So this is very important to be done in the patient to exactly locate where the pathology is in the clinical diagnosis. This can be further done, or all these points can be further confirmed by the laboratory diagnosis. So we have done the etiological diagnosis, anatomical diagnosis, pathological diagnosis, and clinical diagnosis. Now, if we still have doubt, or if we want to clear the doubt whether the diagnosis is very correct, then we can go for laboratory diagnosis. I have not touched this in detail because this is a very detailed chapter. Each section is a detailed chapter, but in precise, very important, the gold standard would be the MRI for these pathologies related to the low back. Can you put on the next slide, please? Yeah, thank you. So in this slide, you can see the different structures in the MRI. You can see the quada equina, at the level of L1, L2, the spinal cord ends. After that, it is the tuft of the nerve fibers that are present, which comes out of the nerve through the foramina at different levels, giving rise to different nerves. Therefore, you have the quada equina there. Then you can see the subarachnoid space. You can see the spinous process on the posterior aspect. You can see the vertebrae. In between the vertebrae, you can see the intervertebral disc. Here you can see in between L4 and L5, the disc is completely black. The disc above that, you can see the white portion in the center. This makes a difference. Since the nucleus pulposus from the middle has moved out of the annulus fibrosus, the disc has become black there in the MRI, and also you can see the disc which is bulged out and which is herniating. You can see the herniated disc between L4 and L5 vertebra. In the next, you can see on the side, there is one more MRI where you can see at two levels between L4, L5 and L5, S1, there is the herniation of the disc. So this is a gold standard to confirm your diagnosis under the heading of laboratory diagnosis. The next slide will show you once again the herniated disc, very particularly between L4 and L5 and S1 vertebra. You can also later you can collect these slides. It will be shared with you. You can also look into the other structures which are present in and around. This is of importance when it comes to the management, which I'll be dealing with in the next session. If you can, in the next slide, you can see very particularly a condition of spondylolisthesis. If you look into the longitudinal curvature of the spine, you can see at the level of L4, L5, the L5 vertebra has moved from the normal architecture. So this is a type of pathology where the whole vertebral body moves out of its normal architecture is called as spondylolisthesis. You can see even the disc has skipped out. Here the treatment becomes very difficult because this requires to be stabilized. Only after that the treatment, the conservative treatment requires to be given. Therefore, this is a gold standard to differentiate whether it is spondylosis or it is spondylolisthesis, which is very important when it comes to employing the treatment. I said in spondylolisthesis and in conditions where there is disc herniation, it is very difficult for the patient to raise the leg. The patient cannot raise the leg above 30 or 40 degrees. Therefore, this has to be always kept in mind before you start the treatment. If you can take the next slide, please. You can see the spinal canal stenosis. You can see a small lesion there, which is obliterating the spinal canal. So this is MRI of spinal canal stenosis. In the next slide, you can see the tumor. Yeah, you can see the tumor there, the white patch which is present, which shows the area where the tumor is present in the body of the vertebra. In the next slide, you can see the spinal, you can see the cancerous tumor, and also you can see the cancer in the vertebra. Here also the patient will present with similar symptoms, but before giving the treatment, you have to confirm this. In such a condition, the conservative treatment will not help. Therefore, laboratory diagnosis is also very important. Or when we start the treatment and if the patient does not respond in such a condition, laboratory diagnosis is very important. So with in the next slide, you can see the tentative diagnosis at each and every step. When we go through the patient in the clinic, we require to think on these different steps and elicit it. And at every step, we should do a tentative diagnosis whether the patient is suffering from KATI SHOOLA, Vataja Anatmaja Vyadhi, or he is suffering from Gridrasi. If he is suffering from Gridrasi, whether he is suffering from Vataja Gridrasi or Vata Kafaja Gridrasi. So with respect to differential diagnosis, you can see the next slide. There are many diseases. I told you in the beginning while dealing with the pathological diagnosis, various diseases which are explained in the textbook finds merit when you come to the differential diagnosis. In Kati Graha, very particularly, in all these conditions, Kati Graha, Gridrasi, Sandigata Vata, Amavata, Vata Jwara, in all these conditions, there is pain in the low back area. The patient is having the Kati SHOOLA or the Trikavedana in all this area, and stiffness is also present, except sometimes in Gridrasi and Sandigata Vata the stiffness may not be present, but in all other conditions this graha or the stiffness is present. Now, the involvement of other joints may be present in case of Sandigata Vata, Amavata, and Vata Jwara, but in case of Katigraha and Gridrasi, other joints are not involved. So, when you go for differential diagnosis, most important thing is you should look into the primary symptoms. In case of Katigraha, it is the Kati SHOOLA and Kati Stamba that will be present. If the patient is suffering from Gridrasi, Spik Purva Kati Prishta, Uru Janu Janga Padoiho Kramat pain presentation will be present with Arochaka and Tandra. If the patient is having Kafaja involvement, and in case of Sandhivata, the patient will have Vatapurna Dhritisparsha, Shota and Shula, along with Atopa Akunchana Prasarana Vedana. So this makes the differential diagnosis. If the patient is suffering from Amavata, Vrachika Damstavat Vedana should be present with the associated symptoms like Alasya, Gaurava, Jwara and Apaka. If the patient is suffering from Vata Jwara, Trika Vedana may be present, but Jwara will be essentially present, which will cleanse the differential diagnosis. Patient may be also present with other associated symptoms like Mukhasusha, Radgraha, and Shushka Kasa. If the patient is suffering from Vrikkacha Vidradi, I said differentiation of urinary system is also very essential. Now, this is explained in Ayurveda, wherein you can see the Vedana, Trishna, Moha, as well as the pain in the low back area. In case of Kshatakshina, in all these conditions, could be Kshatakshina, Pandu, Sangrahani, Vatapakva, Atisara, in all these conditions, pain in the lumbar region is present, but stiffness is absent in case of Pandu, Sangrahani, and Vatakafaja, Vatapakva, Atisara. Now, involvement of other joints may be present in Kshatakshina and Pandu, but in others it is absent. Now, what makes the differential diagnosis is the primary symptom that would be present in the patient. If the patient is having Kshatakshina, he will have Shonita Chardi along with Kasa and Uroruk. That is pain in the chest. And if he is suffering from Pandu, then the Pandu Varna in the face as well as over the body, tongue, etc. will be present along with Durbala, Durbalata, Gatrashula, Ritaspandana. Gatrashula is present pain all over the body. And if the patient is suffering from Sangrahani, then the patient will present very principally with Pakwa Amamala Pravritti. Pakwa Amamala Pravritti will be one of the feature. And associated there could be Balakshaya, Shuna Padakara, Parvaruk, and Jwara. If the patient is suffering from Vataja Pakwa Atisara, then in such a condition, the patient will present mainly with Atisara along with Kukshitoda as well as Admana. If you can put the next, yeah, thank you. So now I said in case of females, one is the reproductive system that has to be evaluated thoroughly. And if the patient is pregnant and if there is upastita prasava, in that condition there could be pain in the low back, but stiffness, involvement of other joint, etc. will not be present, and the pregnancy would be obviously seen in such a individual, not patient, such a individual. So Mutra Purisha Pravritti, Yonimukha Shleshma, these all points out that there is upastita prasava, and this is not very difficult to diagnose, but one should have this in mind when they do the differential diagnosis. The other condition is the Medakshaya. In case of Medakshaya, there could be pain in the low backache, but stiffness as well as involvement of other dhatu will not be present. The primary symptom that the patient will have is Dhatu Kshaya. You can see the Dhatu Kshaya. Patient is emaciated. This will help you in differential diagnosis. The patient can have associated symptoms like Pliha Vridri and Sandhi Shunyata, etc. So this will further guide you through the differential diagnosis. I said in some conditions, in Bagandhara Purva Rupa, also the pain in the low back ache is complained of, but stiffness as well as involvement of other dhatu will not be present. The diagnosis is very obvious. You can see a Nadi Vrana there, and this will cleanse the diagnosis. And if the patient is taking food in less quantity, that is hina matra ahara, in such a condition the patient also suffers from low backache. You can find lot amount of patients with this, and they keep on treating the lumbago and sciatica and they do not get result. You require to ask this always. Here as a primary symptom, you will get the history of continuous taking food in less quantity. The patient will also have Bala and Varnakshaya, Balakshaya, Varnakshaya. Sometimes he will have Udavarta and also complaints related to Vajikarana, like the patient will be Avrashya. If the patient is suffering from Pakwashaya Gatavata, in this condition also there will be low backache, but Antrakujana would be one of the symptoms that will clinch the diagnosis. Associated with that, the patient will have Shula, Atopa, and Anaha. So this will help you to make a very clear-cut diagnosis. Can you put the last? Yeah, this is the last slide we have. The next condition would be Gudagata Vata, Vata Rakta, Kanja, Pangu. In all these conditions, low backache is usually present, but in Kanja and Pangu, sometimes it may not be present. But in any of these conditions, stiffness of the joint is not present. And involvement of other joint could be present in case of Gudagata Vata, and even in Vata Rakta, this can be present, but in Kanja and Pangu, this is not usually found. Now, if you are to achieve the particular diagnosis, to make a differential diagnosis, the primary symptom in case of Gudagata Vata, you will have Vata and Mutra Graha associated with Shula, Admana, and Sharkara Utpatti. In case of Vata Rakta, the patient will have Bhedanavat Vata Pida. The intense pain will be present associated with Sandhi Shaitilya, Alasya, Sadana, and Pidikodgama will be present. And in case of Kanja and Pangu, you can see the Kriya Hanita in the lower limb. The patient will be limping or the patient will have a decrease of activity in the lower limb. This will help. These many conditions require to be there in your mind when you have to do a Ayurveda differential diagnosis, when you will be taking the history. So in each step of etiological diagnosis, anatomical diagnosis, then you have the pathological diagnosis, clinical diagnosis, laboratory diagnosis, then you have the differential diagnosis. So in all of these stages, all these conditions should be in your mind so that you can diagnose the patient better. So in next 2 slides, you have the references for all this. You can open the book and read it in detail, because I understand when we have a small presentation, when we do this differential diagnosis, because this differential diagnosis itself requires a lot amount of time. So next slide, please. Next slide. Yeah. So once all these steps have passed, now it becomes very crystal clear whether the patient is suffering from KATI SHOOLA. If the patient is suffering from KATI SHOOLA, then it is Vatajananatmaja Vyadhi. And if the patient, or the patient is suffering from Gridrasi, whether it is the Vata presenting as Vatajananatmaja Vyadhi, or whether there is Kapha Samsarga. So with this, we can arrive at the diagnosis. In the next session, I'll be talking about the strategies of treatment. In KATI SHOOLA and Gridrasi, I'll be taking only these 2 conditions and how we can plan the Shamana Aushadhi as well as Shodhana. So what should be the strategies, how to take the patient, how we should use the technologies and the clinical diagnosis, pathological diagnosis, as well as the radiological diagnosis. So we have dealt with that. How it is used when giving the treatment will be dealt in the next session. So before I end my session, I once again I prostrate to the lotus feet of His Holiness Pujya Shivaratri Deshikendra Mahaswamiji. On this occasion, I would like to thank Dr. Sarbeswarkar, the principal of the college, Dr. Rajesh Udpudi, the dean of the college. I'm really indebted to both of you for giving me an opportunity. I would like to thank Dr. Beena, Dr. Deepa C. Patil, Dr. Komala, Dr. Pooja S., Dr. Unne Krishnan, who has done the master of the ceremony or the moderation very well. And also, I would like to thank Dr. Madhusudan, who has been instrumental in successfully completing this seminar. I would like to thank all the participants. If you have any doubts, then you can send those doubts to me on WhatsApp. I can clear it. All these slides, I request Dr. Madhusudan as well as the Department of Kaya Chikitsa to post these slides to all the participants so that they can use this slide and they can continue the study. We have started this study here. I request all of you to continue this study and make best use of it. Thank you all. Thank you.
Thank you, sir. Thank you so much. It was really thought-provoking and highly informative in regards to diagnosis and this differential diagnosis of Gridrasi and KATI SHOOLA. Now, I request, before going to Rajesh sir, I will ask any doubts are there. You can just raise the doubts. Okay, now we request Dr. Rajesh Udpudi, Professor, Dean of the institution, to give a concluding remarks.
Om Shri Shivaratreswara Namaha. Good evening, everyone. As you know, these 2 KATI SHOOLA and Gridrasi are very commonly seen in day-to-day practice. That's why Department of Kaya Chikitsa thought to organize a guest lecture from an eminent scholar like Dr. Ajanta. In a short and sweet manner, with the golden standards, he tried to explain about the differential diagnosis from the Nidana, investigation part, even the Lakshanas, everything. It was a very wonderful session. And remember, Sandhi SHOOLA or KATI SHOOLA, lower back is seen from the school-going children up to the old age. Now it is common. So we have to diagnose whether it is KATI SHOOLA or Gridrasi again, Spandana or radiating pain, and what are the investigation you are supposed to. Start from the X-ray, CT scan, MRI, clinical methods, as Ajanta told very nicely, you should adopt it, because these two complaints are seen and everybody used to suffer in their lifetime once, what I felt in day-to-day life. So that's why, so they approach us, and he has elaborately told a differential diagnosis, the involvement of dosha, dhatus, everything he has told, and even involvement of the urinary tract infection, especially in PCOD or the PID or the gynec problems. So detailed the things in a brief, in a stimulated time he has explained. I thank Dr. Ajanta for a nice presentation reaching the student level. And tomorrow we expect the treatment for the same. Shamana, Shodhana, what best Kaya Chikitsa person can do it. So I hope everybody got the feast of knowledge in this lockdown period, online that is. So with from my side and the department, I thank, and I conclude here. Thank you.
Thank you, sir. Thank you very much.
Yeah, thank you all. The session will be continued on next Wednesday, that is 26th May. And sir will be talking about the management part of Gridrasi and KATI SHOOLA. Thank you all. Thank you, sir.
Thank you, sir. Thank you, Ajanta, sir.
Thank you all. Thank you. Thank you, madam.
Thank you.